Worldwide, we are seeing the last century that medicine has largely focused on the management of symptoms, particularly when managing chronic diseases. When it comes to disease management, most often doctors are taught to both diagnose and treat disease, and there's obvious reason for this. The concern with this approach is that it is a disease-based approach. So when one is managing chronic disease, one manages the symptoms to try and help not only the person feel better, but also manage their chronic disease. There are fundamental flaws in this approach. Primarily, the fundamental flaws is that you're not actually addressing the cause of the underlying disease. So when one gets to managing symptoms and a chronic disease with chronic drugs to alleviate symptoms and make the person feel better, you actually neglect the cause. The problem is that medicine has not addressed the cause of chronic disease for quite some time. The paradigm shift that medicine has undergone in the last while, particularly since the emergence of various academies around the world embracing integrative medicine, is really to address the cause of disease rather than manage the symptoms. There is a need for every sub-category of medicine really to help people. However, to manage chronic disease by masking symptoms does not alleviate the disease or really help the person in the long run. What it does do is aggravate symptoms in terms of side effects of the treatments or induced by the treatments or by the disease itself, because if you're not addressing the cause of the disease, you will never ever actually cure the disease. So the paradigm shift that has happened in medicine really has come about because people have realized that chronic diseases for the last century have not, and maybe for longer, have not been managed as well as they could have been. So, where does that leave us today? We, in 2011, and we have so many options open to us, and where do you go? You know, you sit with a diagnosis of menopause, or cancer, or some degenerative disease, or fatigue, or some medical issue, and you don't know what option is the best option because you indoctrinated to believe, whether it be during your upbringing or through your religion, you're indoctrinated to believe that there's a certain path to follow. What has happened with medicine the last decade in particular is that more options have become not available, because they've been available for a long time. The options have become more known. And this is where I would like to actually start the introduction to the Institute for Integrative Medicine. Because the Institute for Integrative Medicine really is not anti-anything. We are not anti-conventional medicine. We are not anti-allopathic drugs. We are not anti any complementary or alternative medicine treatment. We use what works. And the nice thing about integrative medicine is it encompasses all forms of medicine, whether it be complementary, alternative, or allopathic. You use what works for you. And that said, the biggest criticism I have faced embracing alternative or complementary treatments as a physician, as an internist, the biggest criticism I have faced from my fellows is that complementary and alternative medicines aren't researched and are not science-based. This is not true. Complementary alternative medicines are very well researched. It is a science-based form of medicine, and this I would like to highlight because evidence-based medicine is very important. Placebo-controlled trials are very important to assess the efficacy of drugs. However, complementary alternative medicines are also science-based. they're also researched and also studied. In fact, when you look at antioxidants and vitamins and complementary and alternative medicines, there are actually so many trials out there, exceeding the volume of trials for pharmaceuticals. The point is not really a competition between evidence-based medicine and science-based medicine and complementary alternative medicine versus allopathic medicine. It's not about a competition, and it's not about a divide anymore. It's about a change in medicine. It's about a merger between complementary alternative medicine and allopathic medicine, and doing what's best for you. And that is what integrative medicine is. It's about embracing, encompassing all the different options that are open to you, and they are all science-based. And there's no woo-woo about something that isn't allopathic anymore, because the alternative and complementary alternatives have their own science to back them up. And more doctors and more people are embracing the idea that integrative medicine is the way to go. So the first thing I would like to actually mention about integrative medicine is that it is science-based. Integrative medicine is not anti-anything. We are pro-embracing any modality of medicine that will help your health and sustain your health and cure any chronic ailment that you have. Part of that, and part of the realization that integrative medicine is here, is to realize that you are primarily responsible for your own health. Allopathic medicine often, especially in terms of treating chronic disease, alleviates symptoms. So, for example, if you have pain, you take a pain pill. If you have depression, you take an antidepressant. If you have a high cholesterol value, you take an anti-cholesterol pill, and so on. So it alleviates symptoms. So in the short run, you will feel better, but it certainly doesn't alleviate the underlying problem. When you take responsibility for your health and for your well-being and for your longevity, what you really do is embrace integrative medicine, because that is what it is about, taking control of your own health and using what works for you and best for you. And that brings me to the second point. Integrative medicine is not only science-based and not only not anti-anything but encompassing everything, it is also a personalized, individualized approach. And what do I mean by that? It's as simple as that. Integrative medicine realizes or embraces the thought that each person is an individual with their own biochemical individuality, and to give one pharmaceutical or one complementary or one alternative treatment for the same problem for a multitude of people will never work, because each person is an individual. And this is a fundamental principle that people are starting to realize. As much as we are connected, we are still, at the end of the day, an individual. With our own genetics, as similar as they are to another person or a family member, we are still individuals, and we have our own individuality. So what works for one person for one disease may not work for another person with the same disease, and it may also not work for another person with a different disease, and yet again it may work for another person with a different disease. So it becomes very complicated. The point is that we are, as individuals, we have genetic differences, we have emotional differences, we have philosophical differences, we have psychological differences, we have our own personalized views about how to approach our health and well-being, and different things are going to work for you as an individual. So the second point I'd like to highlight about integrative medicine is that the movement, the paradigm shift in medicine is really about making you the center of control of your health. It's a personalized, individualized approach, but you take control of your health and you use what works for you. The third point I'd like to point out is that really, and it's quite important to accept that we live in an environment, and as much as you embrace the idea of looking after yourself, we live at the moment in this world that we live in in a very toxic environment. And the environmental influences affect us. So there is an interaction between our internal milieu and the external environment. This internal-external interaction has a pivotal role to play in our health and well-being. Unfortunately, we have seen over the last years to decades a major increase in conditions such as cancers and degenerative diseases and autism spectrum disorder, for example. And environmental toxicities are playing a huge role in this. And in terms of health and wellness and well-being, we need to understand that environmental toxicities are playing a huge role. And we need to not only look after our own detoxification, we need to stop toxifying the world that we live in. Autism, for example, and cancer that is expressing itself in society is really a reflection of what the environment is doing to us. And it's really a reflection, the environment is reflecting only what we're doing to the environment. So that interaction between the external environment and the internal environment is fundamental to understand in integrative medicine. What we need to do is really clean up our world and stop toxifying it. But what we need to do for ourselves is to realize that detoxification is a fundamental principle in the sustenance and maintenance of health. It goes hand in hand. Over-toxification, detoxify more. Detoxify the environment, we will need to detoxify ourselves less. So, just to recap on what I've said, integrative medicine really embraces everything. It really is an interaction, or it embraces the idea of an interaction between ourselves and the environment. It really embraces the idea that we are biochemically individuals and that you can never use one-size-fits-all or a one-size-fits-all approach where you use one drug for one condition for everyone, because everyone is different. We are all similar, but we are all different, and we have different requirements, and different things are going to work for different conditions. The fourth thing I would like to mention about integrative medicine is really the idea that there's a web of interconnections within your body that sustain your health. And the idea really is very complex, and when one studies integrative medicine, you need to really understand the web of interconnections. For example, life is really an energy force. So there's a flow of energy in, for example, food intake and digestion. So that is the intake of energy. And then once in the body, the macro and micronutrients and the air that we breathe need to be assimilated and metabolized and processed. And various systems are in place to process the information that we have given our bodies, whether it be psychological or whether it be nutrient-based or whether it be the air that we breathe or the food that we eat or the supplements that we take. That information needs to be processed by the body through various systems. Your cellular communication, your cellular metabolism, your endocrine system, your detoxification system, your gut, your neurotransmitters, and the interaction of these systems with each other will allow that intake of energy to be assimilated to result ultimately in health, and then also the elimination of waste. So that web of interconnections is a complicated aspect that needs to be studied for the maintenance of health. And the idea behind the Institute for Integrative Medicine really is to not oversimplify integrative medicine, but really to compartmentalize this web-like connections that occur within the body. So, for example, to understand the web of interconnections, you could focus, for example, on nutrition and supplementation. Nutrition has become increasingly more a problem over the last few decades due to various reasons. You know, our soil is depleted of nutrients. The produce that we produce these days is not as full of nutrients as it was before. The storage of food, the transportation of food, the cooking of food, the freezing of food, all depletes the food that we eat of nutrients and micronutrients, vitamins and minerals. So nutrition is really paramount or of paramount importance in the web of interconnections. And we have become increasingly aware the last few decades of the importance of supplementation, and that we're not getting enough nutrients from our dietary sources. And it's not just because of micronutrient depletions in our soil or our foods. It's really because we're living a busier life, a more stressful life, and our nutrient requirements are not met with our diets. Everyone is well aware of the need for 5 to 9 fruit and veg intake, but very few actually accomplish that in their busy lives. So the need for supplementation has become very apparent and proven in the literature. So nutritional optimization is a fundamental part of the web of interconnections. And in the IFAM online program, a lot of time will be spent on nutritional optimization. You can never be well, you can never be healthy without being nutritionally and hormonally sound. So nutrition, whether you want to do it on diet alone or with diet and supplementation, the logical option, you cannot sustain health without adequate nutrition and optimum vitamin and mineral status. So in terms of the web of interconnections, it's always a good place to start with nutrition. Hormones deserve a lot of attention. Hormone decline certainly is one of the major reasons for age acceleration. And most of the degenerative diseases that we treat these days as doctors are due to age decline. If you look at, for example, arthritis and diabetes and cancer and dementia and heart disease, all of these degenerative processes are largely due to hormone decline. And hormone decline really accelerates the aging process, and it's not the aging process really that causes the hormone decline. So as part of the web of interconnections, focusing on nutrition and supplementation needs to be addressed, but certainly hormone decline needs to be addressed. And for many years, even as a medical student, hormone decline for me was you have menopause or you have an underactive thyroid. It's way more complicated than that. There's a whole web of hormones that communicate with each other. For example, your adrenal glands can become exhausted at around the time of menopause. Your ovarial function can become declined. Your testicular function can become declined. Your pituitary function can be declined. So there's a whole lot of endocrine pauses that occur, and it's very important to make sure that hormone restoration occurs as part of your web-like connection to sustain health. What we have realized the last 50 or 60 years is that great progression has been made in terms of hormone restoration. In the past, we have used synthetic hormones to try and restore hormone health in human beings. And we have, for example, used pig insulin to restore insulin levels. We have used horse mare urine, equine estrogens to try and restore human estrogen levels. This is an approach that was warranted at a time, 50 or 60 years ago. We know now that bioidentical hormones are available, hormones that occur or equivalent hormones to the hormones that occur in human bodies are available, and this is the way to go. Why would you want to use a hormone that is foreign to your body when bioequivalent or bioidentical hormones are available? The point is, part of the web-like interactions or connections involves hormone restoration. And the more bioidentical you can go and the safer the route you choose, the better. So hormone restoration is certainly a critical element in terms of the web-like interactions that occur in the restoration of health. And integrative medicine really encompasses the idea of restoration of health. The third element in terms of the web-like interaction of connections, or the web-like connections, really is about gut health. Gut health really is paramount to not only health but also to prevention of disease. When you think of the barrier between, or the interface between the environment and yourself, the lining of your gut, the bacteria that line your gut, really is your first line of defense between yourself and the environment. Also, 80% odd, of your immune system is housed in your gut. There are more neurochemicals like serotonin in your gut than in your brain. So the restoration of gut health is absolutely critical to the web-like connection to restore your health. Another web, or another component of the web really to consider, is your neurotransmitters, your brain chemicals. As I've mentioned already, there are a lot of brain chemicals in the gut, and in many ways the gut is the second brain, or perhaps your brain is your second gut. But your gut-brain link is certainly well established in latest literature research, and restoration of neurotransmitter balance is critical. As a practitioner, I've seen more and more depression, anxiety, and mental disorders the last few years than ever before. And it might be due to neurotransmitter imbalance in the brain, it might be due to the increased stress that we burden to, it might be due to hormonal imbalances interacting, it might be due to nutritional deficiencies, or gut-brain interactions, or various immune dysfunctions. But certainly mental disorders are more prevalent. So regulating your neurotransmitters and balancing the chemicals in your brain is a very important part of the web-like connection or interaction between healthy functioning or homeostasis in your body. Another element that's really, really important that I've mentioned already is detoxification. Detoxification is an ongoing process that occurs in the human body, and it requires a lot of energy, and one must remember that, because we're living in an increasingly toxic environment. We are expending enormous amounts of energy to detoxify our bodies, and as a result of that, we're energy depleted. A lot of people suffer from chronic fatigue these days. A lot of people don't have the energy really to restore homeostasis and optimal functioning within their bodies. And also repair and normal metabolism requires energy. So living in an increasingly toxic environment, or toxifying yourself, or burdening your detoxification systems in your body, deplete yourself of energy. So detoxification is a fundamental principle to embrace when looking at the web-like or web interactions within the body. To look at other important factors, structural imbalances are very important. Your cellular function, your cellular interactions, your cell membrane structure and integrity is very important. Regenerative medicine certainly focuses on this in many ways, as does nutrition and as does hormonal health. So structural integrity, your extracellular matrix and your cell membrane health is of critical importance to your web-like interaction as well. Often neglected, in our busy lives is emotional and spiritual health, and this is really a crucial element that needs to be attended to as well. You might be concentrating on your nutrition and eating as healthily as you can, and optimizing your hormone balance and making sure your detoxification processes are in place, and yet due to increased stress levels or emotional imbalances or lack of respect for yourself or spiritual issues, your health may suffer. So emotional and spiritual issues, as difficult as they often are to talk about, they also play a crucial role in the web-like connection of interactions within your body that needs to be in place really to maintain homeostasis and well-being. These are some of the web-like interactions and some of the compartmentalizations really of integrative health that will be looked at in the online program or teaching program for the Institute for Integrative Medicine. It is easier to look at things in subsections than to look at it in a broader picture. However, it is important to remember that people are individuals, and that is why I pointed that out in terms of what we embrace in integrative medicine is really to realize that we are individuals, and integrative medicine is really a personalized, individualized approach addressing the cause of disease rather than just the symptoms. But there is a web of interconnections within the body, and in order to study this form of medicine, it does help to compartmentalize the subsections or the different parts that are involved in the maintenance of health. And to study these individually increases your knowledge about integrative medicine, and then once one can combine all of these, you have a better, more holistic approach to the management of a patient. And once again, I emphasize this point. As a practitioner, I have learnt, coming from my background as a conventional physician or a specialist physician internist, to embrace integrative medicine and to embrace complementary alternative medicine and a more holistic approach really has shifted my mindset from managing disease to managing a person. This is not about prescribing chronic drugs for a disease. This is about managing a person on an individualized level and trying to enhance their health, with them taking primary responsibility for their health. The other important thing to remember about integrative medicine, or another important thing to remember really about integrative medicine, is to realize that nutritional and hormone optimization, detoxification, spiritual and emotional health all play an important role, but organ reserve is fundamentally important. And when you nutritionally optimize yourself, if you are at a time of trouble in your life, let's say you find yourself in hospital due to an unforeseen event, or there's a catastrophe in your life and you're in a car accident and you land up in an intensive care unit, your nutritional reserves are very important for your recovery. So integrative medicine really embraces the idea of organ reserve, so that you have resistance to disease. You don't only want to be well, you want to be resistant to the degenerative processes that are associated with aging and or ill-foreseen or unforeseen circumstances that may happen in your life. Talking about integrative medicine, as we have for the last while, we focus really on what you can do for your body in terms of nutritional and hormonal optimization, emotional well-being, spiritual health, enhancing your detoxification processes. Managing your stress is certainly very important as well, through whichever means that works for you. As we've mentioned, it's a personalized, individualized approach. So, meditation works for most people, but not for everyone. Yoga works for some, and various other, de-stressing techniques work for different people. So, managing stress, certainly from a personal point of view, has become one of my priorities in life. Due to my workload and my own stress levels, but I think for most people around the world, I think it's very relevant. And we embrace stress management in integrative medicine as an integral part, really, in sustaining and maintaining your health. That said, whilst maintaining your stress levels, there are certain fundamental processes that are happening within your body that you can certainly help or attempt at least to support. For example, your immune surveillance and your immune system is critical in fighting off cancer. And we are seeing so much cancer these days. It's almost frightening. And I know in my own practice I've seen an increase in a lot of hormonal cancers and a lot of environmental toxin-induced cancers. And this is very disturbing as a fellow human being on this planet. So immune surveillance and enhancing the function of your immune system certainly has an integral part to play in integrative medicine. And supplementation is certainly very important, and good nutrition is very important. I mean, when I was at medical school and we studied vitamin D, we were taught really that vitamin D protects your bones, and that was that. Vitamin D has so many effects on your genes, it's quite astounding, and this information has become apparent the last few years. Vitamin D, for example, has huge benefit for the prevention of breast cancer and prostate cancer and colon cancer and lymphoma and multiple sclerosis and obesity and diabetes, and it's a very important vitamin for insulin receptor sensitization. It has so many effects on your genes. Once again, just underlying the importance of adequate nutrition to sustain health. The point I'm trying to make really with immune surveillance is to try and support your immune system. At the end of the day, cancer we're all subjected to really all the time, whether it be at the level of our spirit or soul or psychological levels, or whether it be actually manifested as an actual cancer. We are all subjected to cancer cells on an ongoing basis, and our immune system kills off these cancer cells with natural killer cells and macrophages and a healthy immune system, which is called a Th1 immune system response. And the younger you are and the healthier you are, the better your Th1 immune system response, and the better your resilience really to cancer. The older you get, or the more debilitated your immune system becomes, the more Th2 immune system response you get, and the more cancer prone you become. That may be due to environmental toxicity, it may be due to genetic influences, it may be due to inadequate nutrition, it may be due to hormonal imbalances. There may be many reasons. In fact, there are many reasons. The point is supporting your immune system is critical in integrative medicine as well. And as you will have heard from this introductory speech about integrative medicine, it is such a broad, such a wide field encompassing so many ideas, and so much more complex than just managing symptoms, that it is really very challenging for a practitioner to practice this kind of medicine, but very rewarding, especially when your patient has realized that they are primarily responsible for their own health, and they are seeking out the best nutrition and integrative approach to sustaining their health. And part of that is stress management and immune surveillance and support of your immune system. That said, when one looks at cancer, for example, we fight off cancer really with our immune system, as I've mentioned, on an ongoing daily basis. And it's really important to keep your immune system in check to ensure that you don't get cancer. The best treatment for cancer is certainly not to get it. So hormone balancing, emotional balance, homeostasis within your body, detoxification, and adequate nutrition certainly goes a long way in terms of prevention of cancer, and that is certainly a fundamental element that perhaps we haven't focused on enough in this introductory talk, and that is prevention. The best way to treat disease is not to get it, and that is called prevention. And that is certainly the medicine of the millennium, and more and more people are encompassing that thought and embracing it. None of us know how long we're going to live, and none of us are guaranteed tomorrow. But what we do embrace, and what we do, or what we would like for ourselves and our family and our loved ones and our fellow human beings, is really that you live your life as healthy as possible, and that you spend a shorter time dying with the degenerative diseases of aging. So integrative medicine really embraces age management, and also the prevention of disease as far as possible. And the earlier you detect disease, the easier it is to repair the web that is at fault, or the element of the web that is at fault at causing the underlying problem. And that is the, I'm perhaps repeating myself, but that is the fundamental paradigm shift in medicine that we are undertaking. Not only that it's now a personalized individual approach and you're treating a person and not a disease, but fundamentally important to the mental shift in the way that you think about managing disease is that you now have the ability, with integrative medicine being here, is to really ascertain the cause of the problem and treat that, and not mask the symptoms with whatever agent you choose, to make the person feel better whilst the disease process continues. If you address the cause, which integrative medicine will teach you, you can eradicate the disease or reverse the disease process. And that is what is so exciting, and that is what has excited me and reignited my passion for medicine. It's about the realization that disease no longer needs to be managed, or chronic disease no longer needs to be managed with chronic drugs. We can address the cause. We can cause the disease to regress instead of progress. And we can turn things around. Instead of this march from health to disease and death, we can actually reverse the whole process and take a path towards health, longevity and well-being, rather than a degenerative process of aging, disease, discomfort, dis-ease and disease and death. Thank you.